hypothermia offers the possibility to use chemotherapies or radiation in lower dosages, which means that patients have less toxicity and less side effects and a better quality of life. So this is one very important feature.
I want to thank you so much for the opportunity to let me talk to you about hyperthermia and the work that you do at your clinic. If you could please tell me a little bit about the history of hyperthermia here in Europe and in Germany.
Hypothermia has a very long history. For example, the local hypothermia has been done first 3,000 years ago in Egypt. There are papyrus rolls showing that it has been used to burn breast cancer tumors. So it's a very old history. And in the last time, it came up in Europe, I think 20 years ago. And now the devices nowadays are much more modern. We have devices using microwaves or shortwave irradiation, or for the very superficial tumors you can use also infrared irradiation.
All right, and when in Europe or in Germany doctors start embracing hyperthermia, start using it as a clinical application on cancer?
I think that started about 20 years ago. I belong to the first who did that in 1993. So at that time it came from Italy. The first devices were from Italy. It came here to Germany, and more hypothermia units were built up.
Does hyperthermia has a reputation or knowledge about common people like standard medicine in Germany?
It gets more and more reputation because you find every month there's an article in any newspaper or some newspapers, and so more and more people know about hypothermia, especially cancer patients. So it's well known, and we have to see the reputation is that far that, for example, in Bavaria, hypothermia is paid by health insurances in some cases. Also in Holland, the hypothermia belongs now to the standard treatments in recurrent cervix cancer together with radiotherapy.
Since you have a formal education in a medical school, how did you transition from that education to do something not conventional like hyperthermia?
Yeah, I had a formal education at the University Hospital of Heidelberg and also at the German Cancer Research Center in Heidelberg, where we did basic science in tumor vaccines and other special methods of tumor treatment. So I had a very conventional education, but when you see the results of chemotherapy and radiation in cancer, you see that's not enough. So you need other tools. You have to improve the situation, and hypothermia could be one of these tools, or is one of these tools. And I've taken that up at that time to improve the situation for cancer patients. Hypothermia has less side effects than radiation or chemotherapy, and it is a treatment which helps to optimize other treatments. So hypothermia is not a treatment which should be used alone. It should be done in combination with other oncologic treatments like chemotherapy or radiation.
How many kinds or types of hyperthermia do you practice, or do you know?
Hypothermia is not just one treatment. There are different ways to do hypothermia. There's, for example, the hypothermia which you can use for very superficial tumors, for example, the inflammatory carcinoma of the skin of the breast. Here you can use a superficial hypothermia with infrared A light, which has a penetration of about 10 millimeters. If the tumors are deeper, not as superficial, so let's say up to 3 centimeters depth, then you can use microwave irradiation to heat up these tissues. And if the tumors or metastases are deeper, let's say, for example, liver metastasis or tumors in other places, then you can use the shortwave irradiation. The principle of the latter two is that the tissue absorbs the energy which is applied by the shortwave or by the microwaves. So the principle is like the microwave oven, the tissue heats up from inside.
How would you explain in a very simple words that what is hyperthermia? Like, is a gentle heat, is something very not invasive in general?
So if you focus on the local hypothermia, this is something non-invasive, not painful, not causing side effects. Of course, sometimes the heat can get too much, but patients normally feel that and can say, oh, it gets too hot. Sometimes hot spots may develop. That's a problem of the technology. But this happens in very few cases, and the patients always feel it. So you can say the local hypothermia is a very simple, easy and safe method of improving the cancer therapy.
And over the years, what are the results that the hyperthermia treatments you have been giving? What are the results you have?
Let's talk first about, I didn't mention all types of hypothermia. Okay. There's also the whole body hypothermia, which compared to the local hypothermia reaches all tumors and metastasis in the body. So in particular in patients who have metastasis in other organs, for example liver, lung metastasis after breast cancer or colon cancer or bone metastasis after prostate cancer, here you can do the whole body hypothermia. Here you use devices which heat up the temperature of the total body up to 42 degrees Celsius, which is about 106, 107 Fahrenheit. Mm-hmm. And in this way you can reach all tumors in the body. So this is, and you can combine that, the whole body hypothermia, you combine with chemotherapy. There's also another way, the moderate whole body hypothermia. It's a type of fever therapy which is used more in complementary medicine. And here, this one is used without chemotherapy. The aim of this treatment, the fever therapy, is more to stimulate the immune system. So these are the different types of hypothermia which are used and which we are using.
Over the years, what are the results that you have been having?
You cannot say in general the results. You have to take it for the specific diseases because every patient is different. So you have to make groups of patients. So for example, let's say breast cancer patients, breast cancer with metastasis. And here we have a success rate in patients with, for example, breast cancer, bone and liver metastasis of 70 to 80%, which is very high compared to conventional chemotherapy, which has success rates between 50% and less. So if you take, for example, the new studies for the first-line chemotherapy with Avastin and Taxol, the Taxol as monotreatment has just a success rate of 16%, and together they have about 39%, which is quite low. And even standard chemotherapies, for example, epirubicin, cyclophosphamide or vinorelbine have higher rates than this new and very expensive combination, but that's something different.
I understand that with most of the conventional therapies, whether it's surgery, radiation or chemotherapy, after the procedure, after the treatment, the patient has a lot of side effects, and usually there is a time to recover from that treatment. How do you compare that with an hyperthermia treatment?
So there's another issue which I should mention, especially in the palliative situation, patients having had surgery and which have maybe metastasis. It's very important to save the quality of life of these patients and to maintain the quality of life. And standard chemotherapies very often reduce the quality of life because the patients have side effects. Hypothermia offers the possibility to use chemotherapies or radiation in lower dosages, which means that patients have less toxicity and less side effects and a better quality of life. So this is one very important feature.
And when the patient finishes his or her hyperthermia treatment, what is the overall ability to move around, to keep doing the normal things of life?
I mean, if we do, in our system, if we do chemotherapy and hypothermia, whole body hypothermia, very often it happens that the patient afterwards comes and asks, did I get chemotherapy at all? Because they don't feel side effects. So you can really build up in this way. But this is not just the hypothermia, this is a complete system. We do the hypothermia, we use chemotherapy protocols which are not as toxic, and which is very important too, we use complementary treatments to support the immune system, to build the condition of the patient up, and also to detoxify the body after the chemotherapy. So I think with this more holistic approach, you have less problems, less side effects, and a better quality of life.
So basically a patient that finishes the treatment successfully, goes back walking home?
Yes, of course. They're not only walking home, also here during the chemotherapy they do some exercise program, walking, cycling, or other things. We have a gym in our hospital. So it's different from other treatments.
How and why did you incorporate all these complementary therapies that you use at your clinic along with hyperthermia?
Because when I worked in the cancer in the University Hospital of Heidelberg, we did many treatments with cancer patients, and I always was shocked that instead of doing something good to the patient, very often it happened that the patient got worse with my treatment, not from the disease, from the treatment. So I remember patients getting high dose of interferon, and they shaked so much that we had to fix them in the bed in the first studies for melanoma treatment with interferon. So that was just terrible experiences. And I think the system has to be changed. You should not just look at the cancer and try to kill the cancer. You should see the patient around. And if you just aim to kill cancer cells, you very often damage also the body. So you have to see both sides. You have to try to do a sufficient treatment to reduce the cancer cells and to damage them. But at the same time, you have to keep the body strong. There are studies showing, for example, high-dose chemotherapy and stem cell transplantation in breast cancer, that patients died even earlier when they got this treatment. So that means the role of the healthy body in the course of the disease is very important. It has to be watched.
How long have you been practicing hyperthermia?
Since 1993.
So do you think the practice of hyperthermia as a doctor, the experience that you accumulate over the years, does it help you to get better treatment to the patient?
Yes, especially in hyperthermia, the experience is very important to find out which are the best programs to use hyperthermia with. For example, you cannot do it with every type of chemotherapy, and the same is the radiation programs. But this is some of this is still under research, and you can see there about 1 or 2 publications per month about hyperthermia showing how to improve this method. So the interest is very big among the scientists in hyperthermia treatment, but unfortunately everything is a little slowly, maybe a question of money. So the research is not sponsored in hyperthermia as it is sponsored in chemotherapy programs.
And I understand with your busy schedule, you still have time to teach in university in Seville.
Yes, yes.
And so how often do you do that?
I have from every few weeks I have to go there for some lectures, student lectures, and also international conferences.
And I understand that conventional oncology, many times the treatment is palliative. And how do you compare hyperthermia, or is hyperthermia and the complementary therapies that you are giving targeted to cure more than palliative? I don't know if I am clear.
I think I understand what you want to know. I mean, we cannot promise miracles with the treatment, with hyperthermia treatment. And if a patient has metastasis all over, a cure is, in most cases, not possible. So if a cure happens, it's like a miracle. So we cannot promise that, but we can use the hyperthermia treatment to improve the chances, to prolong the survival, and to improve the quality of life. So these are very important points which you have to watch. Of course, there are some patients who had a metastatic disease, and now after 5 or even more years, they are still free of tumor. This happens, and we are very happy that we have some of these patients. But you cannot tell a patient, come here, you get cured with a metastatic disease. So I always tell the patient it's a chronic disease like diabetes or arterial hypertension. You have to keep on treating it and to keep the disease under control. And the aim is not made to reach for the cure. The aim is to control the disease so that the patient can live with the disease in a good quality of life as long as possible.
Could you tell me a little bit about the different programs, the complementary therapies that you offer along hyperthermia?
Yes. I believe it's very important that you see how the patient reacts to the disease and to the treatments. And it's very important that if you do a chemotherapy or radiation therapy, that you prepare the body and the patient to do that in the right way. And so we do complementary treatments here which support the body and the immune system. For example, we give infusions with high doses of antioxidants and vitamins before we start the chemotherapy. Then we do the chemotherapy together with the hypothermia, and afterwards we do treatments for detoxification and recovery to support the patient recover from the treatment. This is a big group of treatments, from infusions with vitamins, homeopathic treatments, physiotherapy, ozone treatment, oxygen treatment, and others, magnet field treatment. So with this program we have, we see that patients who had the same chemotherapy outside and didn't tolerate it, they tolerate it here, even at the same dose, and with the advantage that now the treatment can be done and has hopefully success.
If you have to talk to an audience that never heard about hyperthermia, how would you explain in a briefly way the benefits, the advantages of hyperthermia treatment?
I would show first the history, that it has an old history. Also the whole body hyperthermia has a 300-year history, where it has been shown that patients who had high fever after infections and survived the infections at that time without antibiotics, that in some cases they got an improvement or even a cure of cancer. So I would explain that. And then I would show the principles of hypothermia, that's not harmful, and that you can, and I would point out also the study researches. They show that, for example, local hypothermia or hypothermia in general has an influence on the metabolism of tumor cells. For example, P glucoproteins or glycoproteins in tumor cells, which are responsible for the resistance of tumor cells against radiation or chemotherapy. These glucoproteins are destroyed by the hypothermia or get damaged by the hypothermia, and so the tumor cells become less resistant against chemotherapy. That has been shown clearly in studies that patients form a resistance against, for example, mitomycin in colon cancer. Together with whole body hypothermia or hypothermia, the tumor cells got sensitive again and it worked again. So this has been shown in many experiments.
And as the benefits, do you think that the very low side effects or non-side effects could be one of the biggest benefits?
I think one benefit is that you improve the success rates. So you have higher success rates, and this has been shown in all studies about hypothermia. There has not been one study showing that the success rates are less with hypothermia. All studies up to now are positive. Even so, unfortunately, there are not many phase 3 studies, but all the studies up to now comparing groups showed that the group with hypothermia always was better than the group getting chemotherapy or radiation alone. So this is one point, and the other point is, which I mentioned earlier, that you can use more moderate programs of chemotherapy and radiation, which enables patients to live with a disease with a better quality of life. So you have better success rates and better quality of life because there is less toxicity.
What is the biggest challenge or the biggest challenges that you have as an hyperthermia and complementary medicine oncologist to be successful in the medical or business aspect of your clinic? It's a kind of very broad, but is there any particular challenge that you face every day, or?
I think the challenge is every single patient, because we have to work with a very dangerous disease which has high impact on everything, and we have to find in each individual patient the best individual treatment. That is the main problem. Unfortunately, in general medicine, many patients are just treated in certain guidelines which often don't reflect the special situation of the patient. So the challenge is really to find for the individual patient the treatment which he or she needs. I would like to add that I believe it's important, many things are important. It's important that doctors cooperate better together. I think that makes much sense, that the knowledge which is accumulated in different places is put together so that patients really get offered treatment which includes all possibilities. I very often see that patients just get one opportunity to do, for example, chemotherapy or naturopathy or just radiotherapy, and other more modern treatments are not even put into account. For example, laser therapy or regular chemoperfusion or special types of radiation. So I believe it makes sense that doctors of different topics and subjects work together more closely. The second point I believe should be changed is that the general view on cancer. As I mentioned before, you should not just see the cancer which has to be destroyed, so it's not the war against cancer as Reagan declared years ago. It's the fight together with the patient against this disease, and it's also a view that you see that not only the cancer needs to be destroyed, also the patient needs to be supported in the fight against the cancer. And this is, in the moment, not done in the best possible way. I believe if more patients would also add complementary treatments which are necessary and which are wanted and wished by the patients, if more doctors would do that, the quality of oncology treatments and oncologic therapies would be much better.
All right, I really thank you so much for answering these questions, and they will help a lot of people to make the right decision.
I hope so.
Okay. Thank you so much.
You're welcome.